Should I get the vaccine?
Yes, the vaccine drastically reduces not only the risk of becoming infected with COVID-19, but it drastically reduces the risk of getting a severe infection or of being hospitalized or dying from it. And beyond that, the quicker we have large numbers of people vaccinated, the sooner we can stop doing things like masking and social distancing, and our businesses and economy can begin to really fully recover.
So, Doc, the question I have is the vaccine really safe?
Yes, the vaccines are very safe. So far, after over 46 million doses of vaccine have been given in the United States, it is clearly much safer to get the vaccine than to be infected with COVID-19. We're already seeing drops in the numbers of deaths in nursing home populations after they have been vaccinated. To put it into perspective, the risk of dying from COVID is about 1,000 times greater than the risk of a serious side effect from the vaccine. There's a lot of false information spreading on the internet about people dying from the vaccine. In one famous case, a nurse in Alabama fainted after getting the shot, and posts on social media falsely claimed that she had died. Again, less people are dying after getting the vaccine, not more.
Dr. Elkins, is the vaccine safe if you have a history of allergies to other drugs?
Yes, although some people have apparently heard that you need to avoid it if you have a history of allergies, such as to penicillin, that is not the case. That being said, the rare risk of serious allergic reactions to the vaccine, which is occurring about 5 times per million doses of vaccine, is why vaccine providers are required to be able to recognize and treat these rare but serious problems. And it's why patients will need to wait 15 minutes after receiving the vaccine before leaving the area.
Dr. Elkins, can the vaccine cause infertility?
The short answer is no, it does not cause infertility. Some people claimed there would be a cross-reaction of antibodies from the vaccine with proteins in a woman's ovaries that would cause infertility. Not only was the basis of that concern very flawed, a virology lab at Yale actually did tests to show that no such antibodies are being formed after vaccination. This is a really good example of bad information that gets spread widely on the internet, and it's important for us to share the actual scientific truth about this.
When will the vaccine be available?
It's been a bit hard to find the vaccine, but supply is getting better. I'm hopeful that most people who want to get it will be able to get it by this summer, if not sooner. Team members should watch for announcements from the Louisiana Department of Health to see when the eligibility criteria include them. Check ldh.la.gov/COVID vaccine to see who is eligible right now. We're also sending mass texts to legacy patients when we determine they're eligible based on age or medical problems.
How will the vaccine be distributed to our team members?
At this time, we don't know when we might get a dedicated supply for employees or for Legacy Health and Wellness. Because of this, I recommend that if you're eligible for the vaccine before we get it, you take the first opportunity to get it whenever you can.
How much will the vaccine cost?
The vaccine itself is free, although some vaccine providers might charge your insurance for the service of performing the injection.
What vaccine should I get?
The safety and effectiveness of all the available options are so good that my current advice is to get the first one that's available to you. The 2 currently available vaccines from Pfizer and Moderna are very similar, and I would definitely take either one.
How do I get the vaccine, and do I need to sign up?
The primary way to get the vaccine so far is through pharmacies. The website ldh.la.gov/COVID vaccine has a list of pharmacies in Louisiana where it's being given. Some hospitals are also providing it, including Cabrini, which has an online sign-up form at christushealth.org. christushealth.org is also providing the vaccine in Texas. Since the beginning of this pandemic, I've been studying both the virus itself and also the development of vaccines very intently. I've taken the vaccine myself, and I also am pleased that my mother, who's in her 70s, was able to take the vaccine. And I commend the vaccine to you as safe. And if you have personal questions that haven't been answered in this, I would encourage you to ask us and have a conversation about it so that we can help you feel as comfortable as you need to be. Thank you.